The piercing shriek of the monitor ripped through the Grandview Medical Center's pristine aura, instantly silencing the hushed hum of machinery. Baby Liam, barely a week old, was crashing. His tiny chest, exposed for emergency repair, pulsed erratically before fading. Tetralogy of Fallet, Dr. Kenji Tanaka, renowned cardiac surgeon, barked, his voice tight with urgency. Scalpel. The oar became a whirlwind of practiced movements, yet a palpable tension mounted. Tanaka, whose hands were legendary for their surgical artistry, now grappled with an impossible task. He leaned closer, his brow furrowed, delicate micro-tools appearing comically large against Liam's minuscule heart. "Damn it," he muttered, his voice barely audible, "his valves are impossibly small. My hands are too big." The air thickened with despair as Liam's vitals plummeted. Rookie nurse Anjali Rao, usually tasked with retrieving instruments, stood poised at the periphery, her presence almost invisible amidst the crisis. She watched Tanaka struggle, her gaze fixed on the intricate, unreachable problem. No one noticed Anjali's subtle shift in posture, nor the faint flicker of resolve in her eyes. Not yet. But in this room, on the precipice of loss, an unheard whisper of a solution was about to ignite, promising a miracle from the most unexpected source. Grandview Medical Center wasn't just a hospital, it was a fortress of medical elitism, a gleaming monument to cutting-edge science and unyielding hierarchy. Its marble floors gleamed, reflecting the ambition of its residents and the polished chrome of its state-of-the-art equipment. Here, reputations were forged in fire, and the unspoken rule was that status dictated validity. Dr. Kenji Tanaka, a man whose name was synonymous with cardiac surgical brilliance, was Grandview's undisputed titan. His word was law, his methods unquestioned, his pronouncements absolute. In the controlled chaos of Operating Room 3, that absolute authority was being tested by the smallest, most fragile of hearts. Baby Liam, barely weeks old, lay exposed beneath the harsh surgical lights, his chest a canvas of impossibly delicate tissues. The air, usually crisp and clinical, now felt heavy, thick with the scent of antiseptics and the metallic tang of fear. The rhythmic beep-beep of the cardiac monitor, once a steady reassurance, had become an erratic, increasingly desperate plea. Dr. Tanaka, renowned for his precision, now moved with a barely perceptible tremor. His broad, capable hands, accustomed to the delicate intricacies of adult hearts, seemed monstrous, clumsy, as he attempted to navigate Liam's minuscule pulmonary valve and the challenging ventricular septal defect. He'd tried a standard curved needle, then a finer straight one, but each attempt to place the necessary 7-0 proline sutures, already considered micro-sutures in the adult world, resulted in agonizingly slow progress or, worse, minor tearing. The tissue was simply too friable, the space too confined. "Damn it, the exposure is terrible," Tanaka muttered, his voice tight with a frustration rarely heard from him. He adjusted his loupes, the magnifying lenses doing little to mitigate the sheer physical impossibility of the task. "Retractor, wider." Dr. Amar Ndage, a surgical fellow with an ambition as sharp as any scalpel, quickly complied. Ndage was Grandview trained, Grandview polished, and utterly devoted to climbing its rigid ladder. She admired Tanaka, revered his skill, and saw his methods as the gold standard. Her dark eyes, usually bright with competitive energy, were now shadowed with concern for Liam, but also with a keen observation of Tanaka's struggle. This was a crisis, but also a learning opportunity, a chance to witness how a master navigated the impossible. She held the retractors steady, her own hands trembling slightly, acutely aware of the pressure. At the periphery, almost forgotten, was Anjali Rao. A rookie nurse, she was an anomaly in Grandview's sleek environment. Her scrubs, though fresh, somehow lacked the crisp, tailored look of the more senior staff. Her quiet demeanor often led her to be overlooked, an unfortunate side effect of her humble, rural background. She was typically tasked with instrument retrieval, precise counting, and anticipating needs, a role she performed with a silent efficiency that belied her exceptional observational skills. But Anjali wasn't just observing the instruments, she was observing the heart itself, and the fundamental challenge it presented. Her gaze, usually demure, was now intensely focused, tracing the impossibly fine lines of Liam's tiny heart. She saw not just a surgical field, but a landscape where conventional tools were outmatched. She'd seen similar, though never so extreme, cases during her volunteer missions in remote field hospitals, where improvisation and unorthodox methods were not just an option, but often the only way to save a life. She watched as Tanaka struggled again, the 7-0 suture appearing like a thick rope against the pulmonary valve annulus. He tried to tie a knot, but his fingertips, even with the fine needle drivers, simply couldn't manipulate the thread without obscuring the already microscopic field. He swore under his breath, a rare breach of his usual composure. "We need better visualization," Dr. Ndage suggested, her voice an almost imperceptible blend of deference and helpfulness. "Perhaps a different angle on the scope?" Tanaka shook his head impatiently. "It's not the visualization, Ndage. It's the material. These sutures are too coarse, the needles too blunt for tissue this delicate. And my hands," he held them up, his frustration evident. "They're simply too large for this." Anjali's eyes, however, weren't on the standard suture tray. They were fixed on the delicate, almost gelatinous texture of Liam's heart tissue and the tiny, irregular edges of the VSD. She saw the problem more acutely than anyone because she had worked with truly micro-sutures on structures far smaller during her specialized training. She knew, with an unshakable certainty, that 7-0 was not enough. She'd used experimental 11-0 and 12-0 sutures, finer than a strand of hair, during her time abroad, sutures made of specialized polymers designed for neural and ocular repair. Grandview, for all its elite status, wouldn't stock such niche, experimental materials for general cardiac surgery. A fleeting thought, an almost imperceptible shift in her posture, prompted her to speak. "Dr. Tanaka," she began, her voice soft, tentative, almost lost amidst the OR's hum. "Perhaps a finer gauge?" Tanaka didn't even turn. Ndage, however, cast a quick, dismissive glance over her shoulder. Her expression was a subtle cocktail of surprise and thinly veiled annoyance. A rookie nurse, daring to offer surgical advice? The audacity was almost comical. "Nurse Rao," Ndage said, her tone polite but firm, laced with the unspoken reminder of hierarchy, "Dr. Tanaka is a world-renowned expert in this field. I assure you, he's aware of all standard available gauges." She then turned back to Tanaka, offering a more appropriate, Grandview-approved suggestion. "Dr. Tanaka, should we attempt to dilate the annulus first, then reassess for stitch placement?" Anjali, her suggestion swiftly rebuffed, retreated internally. Her shoulders slumped infinitesimally. She knew Ndage was right, within the confines of Grandview's traditional knowledge. But what they didn't know, what they couldn't even conceive, was that standard available gauges were simply not enough for Liam. The specific, almost invisible, detail Anjali saw was the microscopic phrase at the edge of the ventricular septal defect, exasperated by the friction of the relatively thick 7-0 suture. She saw that each attempt, though meticulous, was subtly damaging the already fragile tissue, creating a vicious cycle of failed repairs. The monitor's beeps grew more urgent, a frantic rhythm that underscored the dwindling time. Liam's oxygen saturation dipped again, his small chest rising and falling with increasing effort. The tension in the room ratcheted up, palpable and suffocating. Tanaka, sweat beading on his brow, made another attempt to place a stitch, his brow furrowed in intense concentration. But as he tried to secure the knot, the tissue tore. A collective gasp rippled through the OR. Liam's heart, a tiny beacon of life, sputtered. The monitor let out a long, unbroken wail. A flat line. "Damn it!" Tanaka roared, slamming his instrument down on the tray. "He's crashing. Get the paddles. Someone call neonatology." The OR plunged into a maelstrom of desperate activity. But in the midst of the chaos, Anjali Rao stood her ground, her eyes blazing with a newfound, fierce resolve. The unheard whisper was about to become a desperate shout. The operating room, usually a theater of precise, almost ritualistic action, had begun to fray at the edges. Dr. Kenji Tanaka, renowned for his surgical artistry, now moved with a palpable tension, his brow furrowed, his breath growing shallow beneath his mask. Baby Liam, barely 5 pounds, lay exposed, his tiny heart a fragile, struggling engine within the cavern of his chest. The pulmonary valve, the crux of the current dilemma, seemed to shrink further under the glare of the surgical lights, its delicate leaflets no bigger than a fingernail clipping. "Suction, please," Tanaka muttered, his voice tight. A pool of blood, a testament to his frustrated efforts, obscured the already microscopic field. He wiped a bead of sweat from his temple with the back of a gloved hand, his eyes never leaving the pulsating organ. He had been attempting to anchor a leaflet, to reconstruct the stenosis that threatened to suffocate Liam's young life, but each attempt was met with failure. The standard 7-0 proline suture, the finest typically used in pediatric cardiac surgery, felt like a hawser in his experienced hands. The needle, designed for precision, seemed monstrously large against the whisper-thin tissue. "Vitals are dipping," Dr. Tanaka, the anesthesiologist announced, her voice flat with concern. "SpO2 78%, HR 160 and dropping. We're seeing increasing end-tidal CO2, acidosis is worsening." Tanaka swore under his breath, a low, guttural sound. "More inotrope. Push dobutamine. We need to stabilize him." He grasped his needle driver again, his grip a fraction too firm. He could feel the fine tremor in his fingers, an uncharacteristic lapse in his iron discipline. The sheer scale of the task, a full-grown man trying to stitch a structure smaller than a pea, was pushing him to his limits. Anjali Rao, quiet and observant at her station, watched with a growing sense of dread. Her eyes, sharper than anyone realized, were fixed not just on Tanaka's hands, but on the tissue itself, on the minute reaction of Liam's heart to each attempted suture. She saw it then, the overlooked technical detail. It wasn't just the size of Tanaka's hands, or even the needle's gauge. It was the friability of the tissue, exacerbated by the congenital defect and the stresses of the past hours. The existing sutures, thin as they were still creating micro-tears, a cheese wiring effect, as they passed through the already compromised valve annulus. Each attempt at a new stitch, each pull to secure a knot, simply widened the existing damage, making subsequent attempts even harder. The problem wasn't just closing a gap, it was preserving the tissue that remained. She thought back to the remote mission clinics, to her makeshift operating table under a flapping canvas tent. She remembered the near-transparent skin of infants afflicted with hydrocephalus, the delicate repair of cleft palates in newborns with instruments crafted from repurposed dental tools. She had learned to work with a touch so light, a precision so extreme, that it bordered on the ethereal. She knew, with a certainty that hummed in her bones, that the current approach was only accelerating Liam's demise. "Doctor?" Anjali began hesitantly, her voice barely a whisper against the rising alarm of the monitors. She leaned forward slightly, her gaze locking onto the microanatomy. "Dr. Tanaka, with respect, the tissue integrity, perhaps a different approach to the bite?" Dr. Amar Ndage, the ambitious surgical fellow, shot Anjali a sharp, dismissive glance. Ndage had been observing Tanaka's struggle with a detached, clinical analysis, ready to absorb lessons but certainly not advice from a rookie nurse. "Nurse Rao, this is a tetralogy repair, not a superficial laceration. Dr. Tanaka's technique is textbook." Her tone was cutting, a clear message to stay in her lane. Tanaka, his concentration shattered by the interruption and Ndage's immediate dismissal, grunted. "Not now, nurse. Focus on the counts." His frustration was a palpable cloud in the room, making him unreceptive to anything but his own failing efforts. Anjali shrank back, but the image of Liam's struggling heart, the almost invisible tears forming with each conventional stitch, seared into her mind. The monitor's beeps intensified, a frantic drumbeat of impending doom. SpO2 72% and falling rapidly, the anesthesiologist's voice cracked. BP 45/20. He's going into profound shock. Pushing epinephrine now. Tanaka, ignoring the escalating alarms for a moment, made another desperate attempt. He selected a fresh 7-0 needle, his hands moving with forced deliberation. He attempted a mattress stitch, hoping the wider purchase would hold. But as the needle pierced the fragile tissue, a distinct, sickening rip echoed in the tense silence. A fresh well of crimson bloomed, obscuring the field entirely. "Damn it!" Tanaka roared, slamming his instrument down on the tray. His frustration boiled over into despair. "It's too friable. It's tearing with every pass." He looked up, his eyes wild with a rare blend of fear and self-reproach. "We're losing him." Liam's small body, so recently alive with a flicker of hope, began to seize, his movements growing weaker, more erratic. His oxygen saturation plummeted to 60%, then 55%. The heart rate, once racing, now began to slow, the rhythm growing erratic, punctuated by pauses. The anesthesiologist, her face pale, shouted, "He's going Brady. We're losing the rhythm." Anjali felt a cold dread settle in her stomach, but it was quickly replaced by a furious surge of adrenaline. This was it. The moment she had feared. Liam was crashing, not just from his condition, but from the inability of even the best surgeons to adapt to the unprecedented delicacy of his anatomy. The conventional tools, the conventional thinking, were betraying him. "He's flatlining," the anesthesiologist screamed, her voice hoarse. The steady, urgent beeps of the cardiac monitor suddenly transformed into a long, unbroken wail, an ominous, high-pitched tone that sliced through the tense silence of the OR. Liam's chest, which had been heaving with effort, now stilled. His lips, previously a mottled blue, faded to an ashen gray. The screen flashed a desolate, horizontal line. A flat line. "Damn it!" Tanaka roared, slamming his instrument down on the tray. "He's crashing. Get the paddles. Someone call neonatology." The OR plunged into a maelstrom of desperate activity. But in the midst of the chaos, Anjali Rao stood her ground, her eyes blazing with a newfound, fierce resolve. The unheard whisper was about to become a desperate shout. Amidst the frantic cries and the blare of the flatline, Anjali stepped forward. "Doctor, I think I can do it," she declared, her voice now steady. "With finer tools, I could micro-suture Liam's valves." Tanaka scoffed, glaring. "Nurse, this is no time for fantasy. My hands, trained for decades, failed." Dr. Ndage snickered, "Knitting needles, nurse? This is a heart, not a doll." Just like Anjali, true heroes are often dismissed. Do you believe she can overcome the odds? Don't miss the ultimate underdog story. Hit subscribe to follow Anjali's incredible journey and see if her hidden talent saves Liam. The frantic shouts and the piercing wail of the flatlining monitor were a symphony of despair. Dr. Tanaka, his face a mask of frustration and defeat, barked orders for another round of chest compressions, for more epinephrine. The anesthesiologist was calling out Liam's sats, or rather, the lack thereof. His tiny body was still, a heartbreaking tableau of lost hope on the operating table. The paddles were charged again, the heavy thud of the discharge echoing through the room as Dr. Ndage delivered the shock, but the monitor remained stubbornly, terrifyingly flat. "No rhythm," she announced, her voice strained, still asystole. "We're losing him, Dr. Tanaka." But Anjali Rao, for the first time in her quiet career at Grandview, felt an absolute certainty blossom within her. The humility, the deference, the quiet observation, all of it had been stripped away by the raw, undeniable urgency of the moment. Liam was dying, and she knew she held the only key. Her voice, usually a gentle murmur, now sliced through the cacophony, clear and resonant, astonishing even herself. "Dr. Tanaka, stop the compressions for a moment. Please. I can fix this." Every head in the OR snapped towards her. The frantic pumping of the chest compressions faltered. The crash cart team froze. Tanaka, his back to her, slowly turned, his eyes narrowed, burning with a mix of exhaustion and incandescent fury. "Nurse Rao," he hissed, his voice dangerously low, "this is not a time for theatrics. We are in a code situation. Return to your station." Dr. Ndage, catching her breath from the last failed defibrillation, scoffed openly. "Are you serious? You think you can do what a world-renowned cardiac surgeon cannot? Out of the way, you're interfering." But Anjali didn't flinch. Her gaze was locked on Liam's still form, then back to Tanaka, then Tendage, her eyes alight with an unshakable conviction. No, doctor. With all due respect, you cannot fix this, not with the tools and techniques you're accustomed to. Not for valves this small, this delicate. His tissue integrity won't hold another conventional suture. She stepped forward, her voice gaining strength, an edge of calm authority that defied her junior status. What Liam needs isn't more brute force, or even the most skilled traditional hands. He needs ultra-micro-suturing. He needs sutures finer than human hair, placed with instruments that feel like an extension of the fingertip, not clumsy metal. Tanaka stared at her, his expression a mixture of bewilderment and outrage. Ultra-micro-suturing? Nurse Rao, with all due respect, that's highly specialized. Are you suggesting we have some mythical tools hidden away for a last-ditch effort? Not mythical, Dr. Tanaka, Anjali countered, her gaze unwavering. Unconventional. I've performed procedures like this. Not in an operating theater like this one, but in conditions that demanded improvisation, precision beyond the norm, and an intimate understanding of tissue repair at a microscopic level. She paused, taking a breath, revealing the hidden facet of her past. My rural missions weren't just about basic first aid. We encountered extreme cases, particularly with neonatal and pediatric patients born with complex defects, far from advanced medical centers. We had to adapt. I trained with field surgeons, using salvaged instruments, sometimes even modified dental tools, and experimental sutures meant for reattaching severed nerves. Sutures that are orders of magnitude finer than anything used in conventional cardiac surgery here. I've repaired structures no bigger than a grain of rice. A stunned silence fell over the OR, momentarily overpowering even the mournful flatline. The revelation hung in the air, audacious and utterly unbelievable. Dr. Ndage finally broke it, a sharp, disbelieving laugh escaping her lips. You've trained with field surgeons, she scoffed, recovering her composure. And you expect us to believe you have the expertise to operate on a baby's heart because you cobbled together some makeshift tools in a remote village? This isn't a jumble clinic, Nurse Rao. This is Grandview. This is a human life. Anjali turned her full attention to Ndage, her eyes flashing with a righteous indignation. Yes, it is a human life, Dr. Ndage. And it is slipping away because we are adhering to a protocol that cannot save him. My experience taught me adaptability and a precision you simply cannot achieve with standard equipment on a heart this size. I developed a technique that uses a modified jeweler's loupe for magnification and a unique, almost instinctual approach to handling these ultrafine instruments. It's a different kind of skill set, not inferior, just specific to this almost impossible challenge. Liam's monitor continued its desolate wail. The silence from the medical staff lasted only a few more seconds before the anesthesiologist spoke, her voice thick with despair. Dr. Tanaka, his core temperature is dropping. We can't sustain this much longer. We need a definitive rhythm, now. Tanaka looked from Liam's lifeless form to Anjali, then back again. His reputation, his pride, his very identity as a surgeon were warring with the raw, undeniable fact that everything he knew, everything he had mastered, was failing this child. He was watching a baby die, and he was helpless. The desperate gamble that Anjali proposed, though bordering on the absurd, was the only thing that had even the faintest shimmer of hope attached to it. His gaze lingered on Anjali's steady hands, her resolute posture. There was no arrogance in her demeanor, only an unyielding certainty. He swallowed hard, his face drawn. The weight of Liam's life, and the potential humiliation of this unprecedented move, pressed down on him. But the image of Liam's still chest, the desolate line on the monitor, burned into his mind. Nurse Rao, Tanaka began, his voice hoarse, the words tasting like ash in his mouth. He looked at Ndage, who just shrugged, her face a mask of defeat and reluctant curiosity. What do you need? The question hung in the air, a concession, a desperate lifeline. Anjali's breath hitched, but her resolve never wavered. I need access to the instrument sterile supply room, specifically for any existing micro-ophthalmic tools, or even precision watchmaking instruments if available. And I need the ultrafine monofilament sutures that were rejected from that experimental nerve regeneration trial last year, the ones with a gauge of 11:0 or 12:0. They're too delicate for conventional use, but perfect for this. Tanaka blinked. The experimental sutures. He remembered them. Too fragile, too fine, almost invisible to the naked eye. Useless, they'd concluded. Until now. He made the decision that would shatter his world and redefine the hospitals. "All right, Nurse Rao," he ground out, the words ripped from his gut. "You have exactly 5 minutes to get what you need and be scrubbed in. If there is even a ghost of a chance, if you have any hope, then take it. But understand the gravity of what you are attempting. This is unprecedented. You are on your own." The chaos in the air momentarily subsided, replaced by a tense, expectant hush. Every eye was on Anjali. She nodded, a single, firm movement, and without another word, she turned and sprinted towards the scrub room, a whirlwind of purpose. The impossible had just been given permission to try. Anjali didn't just scrub, she transformed. Her movements in the prep room were a practiced ballet of efficiency, the sterile soap and water not just cleansing her hands but seemingly washing away the lingering doubt and fear that had clung to her. When she re-entered the operating theater, the air was thick with a silence heavier than any she had experienced. Every single member of the surgical team, the scrub nurses, the circulating nurses, the anesthesiologist, Dr. Ndage, and Dr. Tanaka, stood frozen, their gazes converging on her. She walked straight to the instrument trolley, her eyes scanning its contents with an unnerving intensity. "I'll need the fine-tipped straight microforceps from the ophthalmic tray, and the diamond-dusted microneedle holder. And the surgical microscope, if it can be brought in and draped quickly." Dr. Ndage, still reeling from the sudden turn of events, snapped out of her stupor. "Microscope? Nurse Rao, we don't routinely use a surgical microscope for cardiac cases." "We do now," Anjali stated, her voice calm, devoid of the previous hesitancy. "And I'll need the 12:0 polypropylene, please." The specific batch Tanaka mentioned. The circulating nurse, a seasoned veteran named Martha who had seen everything, responded with a surprising alacrity. "On it, Nurse Rao." Within minutes, a mobile surgical microscope was wheeled in, swiftly draped, and positioned over Liam's chest. The ophthalmic instruments, designed for the incredibly delicate work on the human eye, were laid out. The tiny package of 12:0 polypropylene suture, thinner than a strand of spider silk, with a needle barely visible to the naked eye, was carefully opened. Anjali took her place at the head of the table, pulling the microscope's eyepieces into position. The lights dimmed slightly, the focused beam of the microscope illuminating the exposed heart. Liam's chest cavity, already a cavern of intricate anatomy, now revealed the target, the minuscule pulmonary valve, the source of their impossible challenge. Dr. Ramirez, the perfusionist, confirmed Liam was on full bypass, his heart arrested, the surgical field still and ready. She took a deep, centering breath, a quiet ritual from dusty field hospitals where stakes were just as high, but resources scarce. The cacophony of fear and doubt receded, replaced by the profound, singular focus of the task ahead. She looked through the eyepieces. The world resolved into a breathtaking, magnified landscape of pink tissue, glistening vessels, and the impossibly small leaflets of Liam's pulmonary valve, an exquisite, broken bloom. Her left hand, steady as stone, picked up the microforceps. With the precision of a seasoned sculptor, she gently manipulated the edge of a hypoplastic valve leaflet. The tissue was gossamer thin, almost transparent, demanding a touch lighter than a whisper. Her right hand, in a fluid, practiced motion, selected the diamond-dusted microneedle holder. The 12:0 needle, impossibly fine and curved like a sliver of new moon, was grasped at precisely the right angle. Tanaka and Ndage leaned in, their faces hovering just outside the sterile field, their initial skepticism giving way to raw, unadulterated curiosity. They exchanged a look, a shared acknowledgement of the sheer audacity of what they were witnessing. Anjali's first movement was so subtle, so controlled, it was almost imperceptible. She didn't jab, she caressed the needle through the delicate tissue, precisely at the annular leaflet junction of the rudimentary pulmonary valve. The entry point, then the exit, was meticulously chosen, creating a perfect, infinitesimal bite. There was no tearing, no hesitation. The needle passed through as if guided by an invisible force, emerging on the other side. A collective, silent gasp rippled through the OR. Dr. Tanaka, who had performed thousands of heart surgeries, found himself holding his breath. He saw not just a stitch, but a demonstration of control he didn't possess, a level of fine motor skill beyond his own highly acclaimed dexterity. Anjali released the needle holder, adjusted her grip on the microforceps to stabilize the tissue, then ripped the needle, guiding it with the same unwavering precision to catch the opposing leaflet edge. Another perfectly executed pass. 2 minuscule points, now connected by an almost invisible thread. "What is she doing?" Ndage whispered, her voice barely audible, a tremor of awe in her tone. Tanaka didn't answer immediately. He was mesmerized, his mind racing to analyze the technique. She's reconstructing the valve. Not just patching, but reshaping the annulus, augmenting the leaflet edges. It's a form of neo-leaflet formation with tissue strengthening. Like an ophthalmic surgeon repairing a detached retina, but on a pulsating, pediatric heart structure. He finally found the words, his voice thick with a mixture of shock and grudging admiration. Anjali then meticulously pulled the suture through, taking care not to put any undue tension on the fragile tissue. Her hands moved with a hypnotic rhythm, selecting the next precise point, guiding the needle, pulling the thread. Each stitch was a work of art, a miniature bridge of hope being woven into the fabric of Liam's heart. She made a tiny, perfect knot, securing the first suture. It was a single throw, but exquisitely tight and flat, the almost invisible thread holding the leaflet tissue in exactly the desired position. The entire OR was silent save for the soft hiss of the bypass machine and Anjali's low, steady breathing. Tanaka watched her every move, dissecting the angles, the pressure, the sheer spatial awareness required. He saw her use the microforceps to provide countertraction, preventing the delicate tissue from tearing, a technique far more nuanced than his own, broader gestures could achieve. Her grip on the needle holder, Tanaka murmured, almost to himself, it's like an extension of her own nervous system. No tremor, no wasted movement. Ndage, her eyes wide, could only nod. She'd always prided herself on her dexterity, but this was an entirely different league. Anjali was in a trance-like state, a living embodiment of surgical precision, painstakingly rebuilding what seemed beyond repair. She was not just placing stitches, she was knitting life back into Liam's tiny, broken heart. Anjali worked with the rhythm of a master artisan, each breath a silent prayer, each movement a testament to years of dedicated, unconventional practice. The remaining steps were the most critical, demanding not just precision, but an almost intuitive understanding of tissue mechanics and hemodynamic flow. She had already closed the VSD with a small, biocompatible patch, anchoring it meticulously with her micro-sutures, ensuring no residual shunt would remain. Now, her focus shifted to the right ventricular outflow tract, RVOT, and the delicate pulmonary valve. The challenge was Liam's hypoplastic pulmonary annulus, too narrow, almost obliterated. Conventional repair often involved a transannular patch, which could sometimes lead to pulmonary insufficiency later in life. Anjali, however, had a different approach, honed in conditions where resources were scarce and long-term outcomes paramount. She was not just widening the outflow tract, she was sculpting a new, functional valve. With the aid of a specially angled, almost microscopic dissector, she gently released the fused commissures of the pulmonary valve, taking excruciating care not to damage the fragile leaflet tissue. Then, using her ultrafine suture, she began to place a series of strategically positioned neocommissural stitches. These weren't merely to close an incision, they were to create new points of cooptation, encouraging the nascent valve leaflets to form a trileaflet structure that could open and close efficiently. Each stitch was a miniature scaffold, gently coaxing the fragile tissue into a new, functional architecture. She's not patching it, Tanaka breathed, leaning closer, his brow furrowed in concentration. She's rebuilding the valve in situ. Ndage's eyes widened further. This was a technique she'd only ever read about in obscure historical papers, dismissed as too challenging, too time-consuming, too prone to failure for modern surgical practice. Yet, under Anjali's steady hand, it was unfolding with an elegant inevitability. Anjali paused for a split second, her head tilting, reviewing the geometry of the outflow tract. Her movements were economic, no wasted motion, each twist of the needle holder, each loop of the thread, calculated to perfection. She secured the final anchoring stitch, a minuscule knot tightened with a precision that belied its apparent simplicity, sealing the re-engineered pulmonary valve. She then placed a few reinforcement sutures along the length of the RVOT, ensuring no future narrowing could occur. "Ready for saline test, Dr. Tanaka?" Anjali's voice was soft, almost a whisper, yet firm with the confidence of completion. Tanaka, snapped out of his trance, nodded mutely. The perfusionist, who had been observing with equal fascination, prepared a syringe of chilled saline. Withdrawing the bypass cannula from the pulmonary artery, Tanaka carefully injected the saline into the right ventricle. The viewer held its collective breath. Anjali, peering through the surgical microscope, adjusted the angle of her view. As the saline filled the ventricle, the newly formed valve leaflets gently swelled, then closed, holding the fluid without a single visible leak. A perfect cooptation. "No regurgitation," Tanaka announced, his voice thick with astonishment. "And the outflow tract, it's beautifully wide." He gently withdrew the saline, his face a mosaic of disbelief and profound respect. "All right, perfusionist, begin rewarming and prepare for weaning," Tanaka instructed, his voice regaining some of its usual authority, though tempered by a new humility. The perfusionist initiated the rewarming cycle, and Liam's core temperature slowly began to rise. The cardiopulmonary bypass machine, which had been Liam's artificial heart and lungs for hours, was now slowly being decommissioned. The team watched the monitors with bated breath. "BP improving, sats trending up," the anesthesiologist announced, his voice tight with anticipation. As the bypass flow was gradually reduced, Liam's tiny heart, still bruised but now whole, began to beat with renewed vigor. Initially, it was a hesitant flutter, then a stronger, more confident rhythm. The monitors, which had displayed the frantic, struggling heart during the initial attempts, now showed a steady, purposeful pulse. Anjali remained by Liam's side, her eyes fixed on the cardiac monitors, watching the first signs of proper function. The faint flush returned to Liam's pale skin, replacing the ashen hue that had haunted the room for hours. His oxygen saturation climbed steadily into the high 90s, and his blood pressure, once dangerously low, stabilized within a healthy range for a neonate. The echo probe was gently brought back into position. Tanaka meticulously navigated it through Liam's chest, his eyes glued to the screen. He saw the newly patched VSD, tight and secure, no residual shunt. He traced the blood flow through the RVOT, wide, unimpeded. And then, the pulmonary valve. It opened beautifully with each ventricular contraction, allowing blood to flow freely into the pulmonary artery, and then closed completely, preventing any backflow. It was a masterpiece of microengineering. "It's perfect," Tanaka whispered, his voice cracking with emotion. He straightened up, pulling off his surgical mask, revealing a face streaked with sweat and relief. His gaze met Anjali's, a look of profound awe and gratitude replacing any lingering trace of pride. Ndage, her own mask down, approached Anjali. Her usual confident demeanor had evaporated, replaced by wide-eyed humility. "Anjali," she began, her voice barely above a whisper, I was wrong. Completely, unforgivably wrong. That was extraordinary. I've never seen anything like it." Tears welled in her eyes, not of sadness, but of pure wonder and the realization of her prior arrogance. Anjali, exhausted but exhilarated, offered a small, tired smile. "He's going to be okay," she murmured, her voice tinged with the emotion of the moment. The operating room, once a chamber of dread and despair, now pulsed with an electric current of triumph and collective relief. The surgical nurses, the scrub tech, the anesthesiologist, everyone exchanged glances of disbelief and dawning respect. Liam, no longer just a critical case, but a tiny miracle, stabilized on the table, his heart beating strong and true, a testament to the skill, intuition, and quiet brilliance of a rookie nurse who had dared to challenge the impossible. Dr. Tanaka, after taking a moment to compose himself, extended a hand to Anjali. His grip was firm, his eyes shining. "Anjali, what you've done today, you haven't just saved a baby. You've taught us all a lesson in humility, in vision, and in the true definition of surgical mastery." He paused, then added, his voice ringing with conviction, "You, Anjali Rao, are a surgeon." The operating room, which moments ago had been a crucible of despair, now hummed with a different kind of energy, one of disbelief, then dawning elation. The monitors, so recently flashing red alarms and flatlining rhythms, now displayed a steady, rhythmic pattern. Liam's tiny heart, meticulously repaired, beat with a robust regularity that filled the sterile air with the sweetest sound. The SpO2 reading climbed steadily, his arterial pressure stabilized, and the ominous cyanosis that had gripped his lips and nail beds receded, replaced by a healthier, pinker hue. Dr. Tanaka, his gloved hand still hovering over the pristine surgical field, slowly straightened. The lines of tension that had etched themselves deep into his face began to soften, replaced by an expression of profound, almost spiritual, awe. He looked from Liam's now thriving chest cavity to Anjali, his eyes tracing the path of the impossibly fine sutures that held the delicate valve leaflets in perfect apposition. It was a masterpiece, executed with a precision he, a world-renowned expert, simply could not have achieved. "Anjali," he began again, his voice huskier than before, "what you have done, it's beyond extraordinary. The anatomical repair is flawless. The quadrangular resection, the annuloplasty, the meticulous repair of therial septal defect, all perfectly executed. The tissue is viable, the flow is laminar. He's in sinus rhythm, hemodynamically stable." He ran a hand over his tired eyes, then met Anjali's gaze, his pride utterly dissolved. "My hands, my experience, my tools, they were simply inadequate for this. You saw what I missed, you knew what was needed, and you executed it with a skill I didn't believe possible. I was wrong." He finished, a rare, humble admission from a man of his stature. "I dismissed you. For that, I am truly sorry." The admission hung in the air, a testament to the magnitude of the moment. Dr. Amar Ndage, who had stood frozen in her own mixture of shock and self-reproach, finally moved. Her initial dismissiveness, her snide remarks, now burned in her memory. She stepped forward, her face pale, her usual surgical bravado completely stripped away. "Anjali," Ndage said, her voice barely a whisper, then gaining strength. I owe you the deepest apology. I judged you, I mocked you. I saw a nurse, not a clinician of incredible talent. I let my ambition, my assumptions about hierarchy, blind me to what was right in front of me. You not only saved Liam's life, you challenged everything I thought I knew about medicine. What you did today was revolutionary. I am truly sorry." Her apology was raw, genuine, and tinged with a dawning respect that would forever alter her perspective. Anjali, still focused on Liam's stable vitals, offered a small, hesitant smile to Ndage, a quiet acceptance of the apology. She then turned to Tanaka. "Dr. Tanaka, with all due respect, it was your initial work that kept him alive, your understanding of the pathology. I simply had a different set of tools and training for this specific, unique challenge." She paused, her eyes sweeping over the awestruck faces of the surgical team, the scrub tech, the circulating nurse, the anesthesiologist who had meticulously monitored Liam's precarious state. "My expertise, if you can call it that," Anjali continued, her voice soft but clear, "was born out of necessity. In the rural missions where I worked, we didn't have the luxury of specialized pediatric cardiac surgeons. We often had to improvise, to adapt. We saw cases of congenital heart defects that were far too complex for the conventional instruments we had. A mission doctor, Dr. Elias Vance, an eccentric but brilliant man, taught me how to work with ultrafine, almost microscopic tools, custom ground needles, specialized sutures spun from spider silk he somehow sourced, even modified dental picks for micromanipulation. He called it guerrilla surgery, finding a way when there was no way. Her explanation, delivered with characteristic modesty, offered a glimpse into a world far removed from the high-tech, hierarchical Grandview Medical Center. It wasn't genius, she implied, but applied ingenuity born of hardship. Yet, everyone in the room understood it was far more than that. It was innate talent refined by relentless practice under extreme pressure. So, the materials you requested earlier, the microfiber sutures, the specific needle holders, they weren't standard issue for a reason, Tanaka mused, piecing together the puzzle. They were your tools. Your innovation. He looked around the room, making eye contact with the team. Dr. Ndage, please confirm Liam's full hemodynamic stability, begin the gentle weaning protocol for the vasopressors, and prepare for immediate transfer to the pediatric intensive care unit. Anjali, I want you to assist with the transfer and oversee the immediate postoperative care. His directive was not just an order, it was an unspoken elevation of her status, a recognition of her critical role. The operating room transitioned from an arena of heroic drama to a scene of efficient post-surgical care. The relief was palpable, almost intoxicating. The scrub tech, her eyes still wide with wonder, helped Anjali meticulously close the incision, her movements imbued with a new reverence. The circulating nurse, who had dismissed Anjali as just another rookie, now treated her with a deferential respect, anticipating her every need. Anjali, despite the flood of validation and the sudden spotlight, remained grounded. Her focus was not on the accolades, but on the tiny, recovering patient. She checked Liam's peripheral perfusion, noted the improved capillary refill, and confirmed the warmth of his skin. He was out of immediate danger, stable, and embarking on his road to recovery. The true victory wasn't her triumph, but Liam's continued heartbeat. As she helped gently prepare him for transport, she felt a quiet satisfaction. She had done what was necessary, and in doing so, had inadvertently shattered more than just surgical protocol. She had begun to dismantle the rigid, unforgiving hierarchy of Grandview Medical Center, proving that true skill, courage, and compassion transcended job titles and established reputations. The sterile air of the operating room, moments ago thick with anxiety and the clang of instruments, now hummed with a different energy, a potent mix of relief, disbelief, and a dawning understanding of something extraordinary. Anjali, helping to transfer Liam to the pediatric ICU team, felt the weight of unspoken gazes. Dr. Tanaka, usually a whirlwind of post-op directives, stood by the surgical console, uncharacteristically still. His face, etched with a new kind of respect, caught Anjali's eye. He offered a small, knowing nod, a silent acknowledgement that transcended the professional hierarchy that had defined them moments before. As Liam's gurney was wheeled away, a nurse supervisor gently took Anjali's arm. Anjali, the chief of surgery wants a word. And the CEO is on the line. The words were delivered with a deferential tone Anjali had never experienced, a stark contrast to the brisk efficiency usually reserved for junior staff. The next few days were a blur of meetings, debriefings, and an unprecedented level of attention. Dr. Anya Sharma, Grandview's formidable chief of surgery, personally interviewed Anjali, not with an air of interrogation, but of profound curiosity. Anjali recounted her improbable training, the makeshift clinics in remote villages, the necessity of repairing delicate tissues with what was available, guided by an aging, unorthodox field surgeon who saw potential in her nimble fingers. She spoke of using sharpened slivers of bamboo as forceps, of crafting sutures from fine silk thread to mend tiny cleft palates or repair the arteries of malnourished infants, always under immense pressure with limited resources. Her hidden micro-suturing expertise wasn't a secret talent, but a survival skill honed in the crucible of rural medicine. Dr. Sharma, a pioneer in her own right, listened with growing fascination, seeing not just a nurse, but a raw, unpolished surgical talent. The repercussions for Dr. Kenji Tanaka were immediate and profound. His initial public statement, crafted with the help of the hospital's PR team, focused on the heroic teamwork and innovative spirit displayed in saving baby Liam. But behind closed doors, Tanaka's introspection was far more personal. The encounter had not diminished his reputation, rather, his humility in admitting his own limitations and his immediate recognition of Anjali's skill elevated him. He became a vocal champion for Anjali, advocating fiercely for her unique position. Her hands, he stated at a surgical department meeting, are not merely skilled. They possess an innate precision, a gift that we, in our structured training, often refine but rarely cultivate from scratch. To ignore this would be a disservice to our patients and our profession. He initiated discussions about establishing a specialized microsurgical innovation unit within Grandview, with Anjali as its lead clinical specialist, a role unheard of for a nurse, blurring traditional lines and setting a new precedent. He even began to personally mentor her, not in the traditional sense of a surgeon to a resident, but as a seasoned artisan sharing wisdom with a unique protege, teaching her the intricacies of cardiac anatomy from an elite perspective, while paradoxically learning from her adaptive, unconventional approach. Dr. Amar Ndage, initially grappling with her own embarrassment and competitive instincts, underwent her own significant transformation. The sight of Liam flatlining, her own skepticism contributing to the delay, was a stark lesson. She sought Anjali out, not just for the perfunctory apology, but for a deeper conversation. Anjali, she admitted, her voice low, I was so focused on the latter, on proving myself within the system, that I almost missed what truly matters. I let my ego blind me to actual ability. Ndage, who had always valued traditional academic and surgical pathways, now championed a more holistic view of talent. She started a Grandview internal initiative, advocating for a broader scope of practice for highly skilled nurses and PAs, pushing for cross-disciplinary training that fostered collaboration over hierarchy. Her ambition, once singularly focused on personal ascent, now embraced systemic improvement, making her an unexpected ally and a powerful voice for change. Baby Liam, meanwhile, made a remarkable recovery. His tiny heart, repaired with near-invisible sutures, beat strong and steady. The tetralogy of phallic repair, once a life-threatening crisis, was now a testament to improbable ingenuity. His post-operative care was meticulous, involving dedicated pediatric cardiologists and nurses who monitored his oxygen saturation, ventricular function, and pulmonary artery pressures with unwavering vigilance. Within weeks, he was off ventilation, feeding well, and interacting with his parents, who saw Anjali as nothing short of a guardian angel. He would, of course, require lifelong follow-up, but the immediate crisis was averted, and his long-term prognosis was profoundly improved, a future brimming with the promise of a normal life. Anjali's life, however, was irrevocably changed. She didn't return to her authentic life so much as she brought her authentic self to an entirely new existence. The quiet nurse, once content in the background, was now a recognized innovator. Her new role as clinical specialist for microsurgical innovation was formalized, granting her unparalleled access to advanced surgical training, research opportunities, and, crucially, the power to influence patient outcomes beyond the conventional nursing scope. She became an instructor, teaching surgeons and residents novel micro-suturing techniques derived from her field experience, often using tools she'd adapted herself. Despite the accolades and the elevated status, Anjali remained grounded. Her humility was not an act, it was intrinsic to who she was. She used her newfound influence to establish outreach programs, connecting Grandview's elite resources with the rural communities she had once served, ensuring that the lessons learned from Liam's case could benefit those with even less access. She still spent hours with patients, her empathy undimmed by her technical prowess. She found immense satisfaction in applying her meticulous skills, not for fame, but for the tangible impact on human lives. Grandview Medical Center, once a bastion of rigid hierarchy, slowly began to evolve. The Anjali Rao effect became a colloquial term, signaling a shift towards recognizing talent regardless of rank or title. It sparked a broader conversation about interdisciplinary collaboration, valuing diverse experiences, and dismantling barriers that hindered innovation. The hospital's leadership, initially hesitant, soon embraced the positive PR and the genuine improvement in patient care. Anjali's journey from a humble rookie nurse to a groundbreaking surgical innovator wasn't just a personal triumph, it was a beacon for others. It affirmed that true skill, coupled with courage and compassion, transcends arbitrary status. It proved that sometimes, the most extraordinary solutions come from the most unexpected places, carried by hands that are not too big, nor too small, but precisely right for the task at hand, hands guided by an unwavering commitment to life itself. Her future in elite surgery was not merely secured, it was redefined, charting a new, more inclusive path for talent within the hallowed halls of medicine, forever reminding Grandview that the greatest innovations often bloom from the most fertile grounds of human need and ingenuity. Anjali's quiet courage didn't just save a life, it ignited a revolution within Grandview Medical Center. Her journey proved that true expertise isn't limited by rank or title, but flourishes where compassion meets ingenuity. This isn't merely the end of Liam's story, but the beginning of a new chapter for medicine, one where hierarchies crumble, and every hand, regardless of its size or perceived status, is valued for the unique skill it brings. What resonated most with you in Anjali's incredible act of defiance and brilliance? Do you believe institutions are truly ready to embrace such radical shifts? Share your thoughts in the comments below. If this tale of unexpected heroism and profound change inspired you, please like this story, share it, and don't forget to subscribe for more narratives that challenge norms and celebrate the human spirit. Anjali's legacy reminds us, the greatest potential often lies hidden, waiting for the courage to emerge and redefine what's possible.